Okay, I chose the topic of opioid addiction on nursing care. And I chose this topic because I've seen how prevalent this is in the community health care center where I work, as well as in the hospital setting, and how patients are easily discriminated against. And sometimes I feel like nurses aren't even aware on how they're, providing less quality care for this population. I've seen it personally lead to some really bad patient outcomes. I had one patient who was sent into the ER. She had a history of mental illness and opioid addiction. And they really just didn't even want to deal with her and had discharged her when she should have been hospitalized, and she actually ended up having to go in the ICU, etc. Just stuff that had they, not discriminated against her, never would have ended up that way. And sadly, the stigma against those with opioid use disorder reflects a larger societal view that gets carried over into the hospital, and patients are treated as if they don't have a disease, and instead it's a moral failing. Um, the epidemic is nationwide for the opioid crisis, but Kentucky, as we know, has been hit really hard. According to the Drug Overdose Prevention at UK, approximately 81% of Kentucky resident overdose deaths in 2020 was from opioids. Proportionally, Kentucky resident deaths involving fentanyl has increased from 29% in 2016 to 69% in 2020. As a result, the opioid epidemic has impacted hospitals and nurses directly. My purpose in writing this paper, I really just wanted to improve nursing knowledge, to help reduce the stigma in delivering care to OUD patients. In my literature review, a common theme from nurses was that they didn't really have the education or training to effectively care for this population. This included not being able to recognize the signs of physical manifestations of withdrawal cravings. It translated into inadequate pain management, as well as just stigmatizing languages and attitudes, which really poorly impacted the patient experience. I think this is especially evident in the care of women whose babies were born to neonatal abstinence syndrome. One study I read for this paper, women spoke about having their pain ignored, being threatened by nurses about involving CPS, and really just being shamed for taking methadone, even though the doctor was prescribing it and they were following treatment protocols. This all kind of pointed me to the intervention of education. So, education is an intervention. There is a model called the Massachusetts model that I read about. It was designed to address the gap in education for nurses surrounding those with substance abuse disorder. And really, it had nurses playing kind of a lead role in integrated care. And the models based on the Massachusetts model have demonstrated decreased mortality, acute medical needs, as well as increased retention in treatment. The addiction nurse competencies built by one of the authors of the paper I read, she created a competency that had like three core parts to it: a foundation assessment, a skills checklist. And she argues that all nurses must have this fundamental skill set to care for patients with addiction. Um, Education as an intervention is vital to improving patient care. And it really must start in nursing school. I feel like nursing school, it's pretty much focused on getting you to pass the NCLEX. and all the core competencies are surrounding this objective. There is really like minimal mental health education, very little on addiction, and when students get out, they are not equipped to deal with what they're going to face. Um, some barriers to changing education in nursing school is, I think, first of all, it's pretty fundamental. We have to acknowledge that the change is necessary and that schools have to address the need for further education. Nurse educators have to be on board. They really need to use like the mental health effects from the pandemic as well as the opioid crisis to help facilitate and implement this change. Another barrier that gets discussed as well is kind of the time constraints around additional education. And one thing I read about a way to address this is through an integrated approach where students would basically work with patients in addiction across different settings instead of just saying, like, okay, this rotation, we're going to work with patients who have an addiction problem. This would save valuable clinical time and it would, again, kind of get them to seek care throughout the lifespan. Um, Based on the research, there's absolutely no doubt that stigma against patients with OUD negatively impacts their care. It exists even in environments where providers are considered experts in their field. For example, I work in community mental health. We do medication assisted treatment, and you even hear healthcare professionals still really using stigmatizing language, referring to patients as addict or attention seeking, med seeking, etc., etc. I feel like language is important and how we speak about addiction is important. We should be saying, for example, opioid use disorder, not addressing it is like a disparaging in a disparaging way. I don't think education is a cure-all, but I definitely think it's necessary to improve knowledge, to improve patient outcomes, and just put aside barriers in general to provide good patient care.